Well, welcome to another orientation of Shots at the Shop. I'm Omar Neal. I'll be serving as one of your moderators, the former mayor of Tuskegee, Alabama, and host of the You Got the Power show. And today we're going to just address many of the issues as it relates to COVID-19, the Delta variant, what we need to be doing to safeguard our communities, how the barbershops and the hair salons are making a difference in saving lives. And so this is always a thrill to have this conversation, and to have it with the people that we have it with makes it even better. So with that said, my co-moderator, Dr. Stephen Dr. T. Thomas.
Hello,
doing,
hello,
man?
Omar, and all the brothers and sisters out there doing the work, saving lives. It's actually been a great day and a great week, largely because we were out in the field, my friend. We were literally out meeting people in cultural festivals, and we had a chance to create a health pavilion, Omar, and take our model and literally have a pop-up COVID vaccine clinic 10 feet away from a pop-up barbershop and public health education effort. And some of the people in the Hollywood Squares here met for the first time. Dr. Ritter was there with her medical expertise. Chris Sherlock, not Sherlock Holmes, but Chris Sherlock. Look at him with all his new stuff in the background. They finally met. Jale was there with the whole crew. And Andre, yeah, we were bragging on you down and all the things you're doing in Atlanta with all these people. So my point is, it has taken time to catch on. And we had a health director, Baltimore County health person that ran their clinic, who did not know about Shots at the Shop. Then he had a chance to literally witness it in real time. And now he's on board and wants to know, what do we do next? And the last thing I'll say as an update, we'll talk about this tonight. We did our first training of health department people. NACCHO, our national clinical partner, recognized that as they're interacting with the barbershops and salons, they need help. How can we do a better job of being a better partner with them? So today, this afternoon, we did a training with NACCHO. And a little bit later in the show, Omar, I'd like to show this audience what the health department folks are going through. I'm going to put up their word cloud so you can see what they're going through, and then compare that to our own at the appropriate time. So you tell me when. In fact, this might be a good time. What do you think, Omar?
Nah, let's give it a few more minutes.
Okay.
How are we gonna go into that when we don't introduce our lovely panelists?
All right.
We got to give Dr. Carol Ritter her props, man. We got to go there first before we go anywhere.
You're right.
Hey, Dr.
You're
Ritter,
right.
how you doing?
Hello, everybody. I'm really excited too, because I was involved with the Shots in the Shop in person, and that was a real honor. But it also gave me hope, because I saw it in action. I mean, and that's what this all about, is like putting the words to action. And so it was really a hopeful time. It was a very hopeful week, and I haven't used that word in the word cloud yet, but I will today.
Yeah. Oh, wow. Well, that's good. Interestingly enough, if it's one word that kind of comes up as the larger word and more dominant word, it's normally hopeful. Now, we've seen other words, but in all, I think hopeful is probably the word that is the most dominant in all the words we've had over the times we've done this. So I'm glad you're hopeful, Dr. Ritter. Hey, I call him Chris Sherlock Holmes. That's just my name for him. Everybody's got to have a nickname. I nickname it. And let me tell you something too, Chris. When people nickname you, they really love you. They really care. Right. You know that, right?
That's when you know you're in.
That's when you know you is. Or you get
welcome.
a nickname.
You already know. Welcome. I used to be an investigator too, so Sherlock Holmes. That lines right on up with. That lines right on up.
Wow, yeah, I didn't know. See, I'm saying that works out perfectly.
Yeah, I did the
Yeah,
ABC
talk
board at
about
DC.
yeah, talk about what's happening out there, man. And let me thank you too. I want to thank Dr. Ritter for your participation at the Shots at the Shop pop-up clinic, and your rolling up your sleeves to help people is well appreciated. So thank you, Dr. Ritter. And so tell us what you think and what you're seeing, Chris. We know you are our eyes and our ears on the ground.
One word that resonates with me right now is real. This thing that we're up against, this battle is real. Us as humans that are out there on the front lines doing this work is real. And what I saw from this past weekend, our passion for getting the job done and for saving people's lives is real as well. So that's why that one word resonates with me. What I saw from this past weekend, it really brought the word cloud, the word waterfall to life, because I saw people that were motivated. We saw people that were hesitant. We saw people that were not informed. We saw all walks of life, men, women, children, old, young, people with hair, people without hair, people without hair that wanted to get their face cleaned up, or they wanted just to sit in the chair to experience sitting in the chair and having that barber smock put over top of them. The accomplishments that were achieved this past weekend had nothing to do with us as individuals. Nobody knew who anyone was out there. No one was wearing a big hat. Everyone had their sleeves up. Everyone had sweat rolling down their face, and everyone was intentional with our mission. And I'm lost for words just to be a part of an operation, part of an initiative that's saving lives. So yeah. I thank you all for making the opportunity and for experiencing that.
Well, we appreciate you so much, man. You don't know, words cannot express our appreciation and love for you, my brother. All right. Well, we got Andre in the ATL. We got to bring ATL in the house. Andre, how you doing, man?
And I love it when we're the drive time radio for people as they're going about their daily activity. Hey, Andre.
Hey, what's going on, guys?
How you doing, man?
I'm doing good. I'm going to have some more film for you guys pretty soon. After our Shots in the Shop, Emory got interested in us, and they want to do it again and again. So it's turning into something that's going to be somewhat continuous, and we're doing some signs and stuff as we speak, but I wanted to get a little bit more together before I present it to you guys. Sorry about that.
Well, wonderful, man. That's wonderful. And we appreciate, again, I mean, I guess this is an appreciation day as well, because, we don't want to ever take anyone for granted. We know the work you're doing is making a difference. We literally are saving lives one life at a time. And we got to see it that way. I think oftentimes and I talk to Dr. T about this all the time. We get caught up in numbers and how many people got vaccinated or whatever. Come on. Let's do the best we can every time we can to get people to understand that when you get vaccinated, not only are you saving your own life, but you're saving the lives of the people around you. And I think a lot of times people don't understand that there are a lot of people who have contracted COVID, gone and given it to, transmitted it to someone they loved, and then funeralized those people. That's got to be one of the most heart wrenching things to endure, is to know that you contributed to a person that you love death, or anybody's death, but particularly someone to whom you love. And so I think we get it down to this, Dr. T. If don't do it for me, do it for someone you love.
Yep.
Do it for someone you love, right?
When we get to the part of the show, and I can share with you some of the collateral from the festival, I think it might be important for people to see how did we set up a clinic and a barbershop under a tent. One of the things that we did was a motivation board. When people got their vaccination, they came to the board and he asked, what was your motivation? And I want to share that with the group here because Omar, it hits exactly what you're describing and where the communication needs to be now. Communication that I don't see coming from folk who have a lot more resources than we do. The people are telling us, here's what motivated me. And it has nothing to do with conspiracy theories. It was all about saving lives.
It's interesting. I'm going to be on a focus group on next Wednesday, and that's the question. What can we do to motivate people? What questions need to be answered right now that can get people to that space of vaccine acceptance and for people to get the shots? And I think we need to have this conversation. That's why people like you, Andre, and others who are in the shops and who own these shops, we need to hear from you. We need to constantly get you updating us as to what you're hearing, because that's going to give us an opportunity to horn in and frame the issue. And I talk about it all the time. How you frame the issue determines who embraced the cause. And so we need to spend more time framing the issue than just going out there telling people to get shots. We need to find out why they're not getting shots, and then facilitate that part of it, and then provide them shots as well.
Mr. Mayor, something Andre said, I don't want us to lose, and I want all the barbers and stylists out there to keep us abreast of this. Emory came. Andre's had his shop there for decades. Emory's been there for decades. Now they finally come together. But look what he said. Oh, now they want to come back and do filming and all kind of stuff. Well, the same thing happened right here, Andre. When we did our shots at the shop at Katrina's and had all the media people there, a film crew met our clinical partner at Luminous Health. The next thing I know, they agreed to do a film. It ends up in the front page of the Washington Post. And tonight I'd like to be able to show that, Omar, a demonstration of how bringing our clinical partners to the barbershop has unintended positive consequences of bringing greater visibility to framing the issue as we need to be out of the clinic and in the neighborhood. We need to have partnerships with influencers like our barbers and stylists. That happened as a result of bringing people together in the barbershop and salons around this initiative.
Well, why don't you just, if you can find it while we're talking, go on. I think
it's so powerful. It might influence the word cloud. So let's get that out of the way. Let's find out where this audience is.
They're not going to influence how people feel.
You don't
think? They're going to feel that way anyway.
Okay.
If you can make me feel better before that, then I feel good. Like James Brown said, I knew I would.
Let's go ahead.
You remember that, Andre? I feel good. I knew that I would.
Go ahead.
You remember
that? Hey, Jolly, spotlight Aaron Perry and Antoinette. Antoinette, you got to turn your camera on so they can spotlight you for the first time. There you go. And
when I said James Brown, Aaron came on right in time.
Look at him.
He looks like a movie star, doesn't he? He's got that look.
The sun hadn't set in Wisconsin yet.
I just got done with a spinning class, so I'm beat.
So Antoinette has this as her drive time. I just love that part. Let me show you what happened when we bring people together across what we think might divide them. and what can happen when we work together. Now, hold on. You don't have to cross your fingers. I got some skills now. Excuse my desk. Omar, do you have full screen?
Full screen.
Okay. This is our community partner. You've seen our events. You see Luminous Health. This is Luminous Health. And this short film, front page Washington Post you're about to see is a direct result of the crew meeting Katrina and the barbers and stylists. Here we go.
The heart rate has been on its way up.
That's actually the same.
She was 105 consistently.
It's very easy to make an argument to intubate this woman. A compelling argument to intubate this woman a week ago. It's just that, look, if she gets on a vent, I don't know that her mortality is honestly any better than what her mortality is now.
I think everybody's in agreement, right? Almost 100% likelihood she will die from this.
Yeah.
So now it's just how to best support her and her family through it. And I guess
We all, having gone through this for, close to 2 years, were hopeful that, the rollout of the vaccine was going to help end this pandemic. And locally, because of our local high vaccination rates, and we're fortunate to be in the Metro DC, Maryland area where vaccination rates are high, we felt the benefits of that, and we went down to 0 COVID patients, but I think our window is closing. Although we knew deep down that it probably wasn't going to last forever. When that first patient came into the ICU and needed to be intubated in the vaccine era, it was like a gut punch for all of us.
When you do everything you can to not put them on a ventilator and then they go on a ventilator, oh man, the proportion of those people that survive this disease is extraordinarily low.
And what usually is a kind of lively hustle and bustle to get a patient intubated and stabilized was more of a quiet, solemn ceremony. And having gone through something like that the first and second time, you never want to go through anything like that. And I think that's what's important for people to realize, is the toll that it's taking on society for sure, but the disproportionate toll it's taking on the healthcare providers in the hospital. The vaccination, all modalities of the vaccine are way out of this. You went to see somebody.
Yeah, they were hypotensive, give some fluids.
Okay, not us, no. That having been said, we understand people's choices, but the choices have to be based on data and science and reality. And I think that's the frustration that healthcare providers are having right now, is seeing suffering when it doesn't have to be. Hi, remember me? You're looking more tired. You know the safest thing for you now is to be put to sleep and put on the ventilator. When faced with the sensation of air hunger and potential death, it's natural for the mind to go to the what ifs. And the obvious first what if is, what if I got the vaccine? What if I didn't have to think about leaving my son or daughter or wife or husband to fend for themselves? And that's the reality that we all see. And it's easy to have opinions about something until you've seen that and seen that in people's faces. I know you don't want the ventilator, but I mean, what if it was ventilator or death? If it meant saving your life, would you want the ventilator? I think this has to get back to being what it is, and that's a health crisis. It's not about anything more than that. It's not about who you are, or where you're from, or what you believe in, or what you don't believe in. This is a health crisis, and there's ways to deal with it. When you look at it for what it is, the only thing left to do is come together and and
You and RC
defeat
well,
it. I think that's what's tough about this is so many lessons learned, yet we're in the same spot. All the experience, all the surges, it doesn't even matter at this point. It's just, we're in the same spot.
Hold on, let me stop it.
I think that's an excellent presentation. It takes you to the place where it happens. And Dr. Ritter, I tell you, I don't think that we really pay enough attention to the toll that it's taking on the doctors and nurses and healthcare professionals. It's got to be frustrating. It's frustrating to know that every death is a preventable death, and that the overwhelming majority of people who are getting intubated and who are dying from COVID are unvaccinated. That's the frustration. And I don't know why people don't get it now. I mean, over 670,000 people, more than the Spanish flu. And we talked about that before. And people don't get the fact that this is a deadly virus. I don't get it.
It's been really incredibly frustrating because it is preventable. It hasn't always been, but now it is. And it has been apparent to doctors that it's preventable. And it's even if you know that you haven't been vaccinated and you've been exposed, now we even have prevention with monoclonal antibodies. And this is like the hope that I have now, because the monoclonal antibodies, if you know, used to have to be an infusion, but they've modified it now and it can be a sub-Q injection. So this may be something that may be able in the near future be brought to Shots in the Shop, where somebody says, oh my gosh, I got exposed and they're high risk, and you could actually give them a shot of monoclonal antibodies if they haven't been vaccinated, or even if they have been vaccinated, because it's kind of a prevention. But what I recognize now, the healthcare providers recognize it's preventable. Patients hadn't, but at this point now, I have more patients vaccinated coming in and said, I just don't understand the people that haven't been vaccinated. So it is a tipping point here. The general public is not understanding why people don't get vaccinated, because to them, it's a no-brainer. So we are really at a tipping point here for educating not just the physicians, but the patients, because physicians aren't all on board with all of this either, because the science is changing so fast.
You know, what's interesting is that you said that somebody would take something that obviously has not been vetted as much as the vaccines have, not had the kind of scrutiny that the vaccine have, but they're willing to take that, but won't take the vaccine. I don't understand.
Right, because it's a biologic, you know, it's a natural, it's a, you know,
like they know
exactly.
you know, come on, they don't know that from.
So I had a conversation with someone who didn't want the messenger RNA because it's going to mess up their DNA, right? So this coming month, there's going to be another vaccine out there that doesn't have the messenger RNA. It's the Novavax, and that's just a protein. So it's going to be like this plant protein, okay? There's going to be a subset of people who are going to be acceptable to that, right? Because in their mind, it's safer. It's interesting, but we have a lot of options here to prevent this preventable disease.
Well, a lot of people don't know the difference between either of them. So yeah, I don't know if it's just that. What were you saying, Dr. T?
So Omar, this might be a good point to take them into that festival to see what happened, but because it points to what we're talking about right now. Do we go down the rabbit hole and try to explain mRNA or do we do what the people told us was what moved them to roll up their sleeve?
Yeah.
What do you think?
Yeah, let me say hello to Aaron. I mean, how am I gonna have him riding around and and I don't talk to him, and we got Ann with us too. I mean, we got to talk to our people, sis. Hey, Aaron, what's happening, man?
How are you guys doing?
Yeah, you say you've been spinning or something?
Yeah, I'm guilty of the COVID 25, so I got 5 off. I'm working on the next 10, but I got to get the weight off. So it's just a commitment. That's about it. I'm just, again, thank you guys. I know I had probably talked about my brother so much. I just appreciate you guys just letting me vent, and ultimately it paid off for our family, because his daughter and her son are now back with him. And I guess the message that I have is that we got to keep pushing. We got to keep letting people know and not give up, not get frustrated. It's so easy to do.
Yeah, you're right, man. But that testimony was a blessing to us. So we thank you for doing that, because that's going to assist us in really framing the issues we talked about earlier. It's going to take one at a time. It gets to this: who do you love? And I keep saying that. Who do you love? And if you can list the people you love, and you can just write them down, just write down everybody you think you love, and then you need to call every one of them and say, did you get vaccinated?
Don't be worried if you get told off. Don't have to go down the rabbit hole.
You don't worry about that. If people you love and they know
That's
you
right.
love them, you're right. You don't even worry about that. I mean, if somebody's getting ready to get hit by a truck, you don't say, what if I told them that they go stop and don't get hit by the truck? You think they're going to get angry with me? Do we think about it from that vantage point? No. We do what it takes to save their lives.
All right.
That's how we need to be doing with this vaccine and this virus. We need to do what it takes to save the lives of the people to whom we love. That's the point, right? Hey, Ann, how you doing?
I'm well. How are you?
You see how forceful I am on this. You see,
I see you're very passionate, which is
I'm
needed.
very passionate about it. Yeah.
So I wanted to share and update you. I know you said you wanted to hear the word on the street. Channel 10 came to my salon yesterday, and a lot of my family and friends saw me on the news, as well as my clients. And they were talking about the Johnson & Johnson and the booster shot. And they really wanted facts. We did the vaccine initiative. It was very successful. We also are doing the barbershops and hair salons decals in the city of Philadelphia. So we're doing a major promotion online as well to talk about the vaccine and the hesitancy and masking up. So I want to suggest to you, I was sharing with them the Johnson & Johnson. People are very hesitant about that vaccine because they recalled and they said the blood clots, but now they're pushing the boosters, but most people still have not gotten vaccinated. So when I was talking to the media, they understood there's so much information coming out, but yet we all know that Johnson & Johnson had a major lawsuit with the talcum powder, and you can't skim over that when you have major companies still in the forefront. And then we realized that a lot of people had cancer and it was a major class action suit. So for people that are very intelligent, they're frustrated with fake information. And so with the booster shots, they're saying that that's stronger than anything else that's on the market. So I think we have to be very clear and strategic about the messaging. When I did the vaccine drive at my salon, everybody asked me, I don't want the Johnson & Johnson in. I said, well, we have Moderna and Pfizer as an option. So we're not using the Johnson & Johnson. And unfortunately, that could affect Johnson & Johnson media, but we have to be very honest and transparent about the African-American community in which I service. The other thing, and I'll update you with the barbershops, because I'm the president of the consortium, I get a lot of information from different barbershops and hair salons. And just recently, one of my friends who have a top barbershop in Center City was forced to shut down because he was exposed to somebody that had COVID. Now, of course, Thursday, Fridays, and Saturdays are your busiest days in the salons and barbershops. But his whole team had to close down and not make money, as well as himself. And He has a senior which is his mother, that he takes care of, and he has to stay away from her. So I think that when people hear those kind of stories, he was there, he's fully vaccinated, his mother's fully vaccinated, but somebody that was at this Black event for 100 Black men, one of them was diagnosed with COVID, and it affected a lot of the team that was there at that particular event. He came back negative, but he still has to wait until they do the major test. I think is like the first one, the drive-by test where you do the quick rapid test, and then it's the other test that he's waiting to get back for him. And the doctors recommended that he close his shop for 5 business days until he get the right, test results. So that's the update that I have, and I'm extremely frustrated because I will share with a lot of my friends and family that don't want to get the vaccine. I said, you rush to the hospital and the beds are full with people that are not vaccinated to the reason why you're there, but you could have prevented it when you were able to get the vaccine. So if we had to make a mandate, you can't come to the hospital since you didn't want to listen. I do that kind of reverse psychology to say, don't wait when you know you have an option to get the job done. And so it makes some people kind of think, but most of the people that I talk to that's still very hesitant, they feel like it's not enough information for them to go get it. They do want to get it, but they just want to wait until the coast is clear. So that's my update.
So let me speak to her just for a moment, because that shutting down of a shop is exactly what we want to avoid. You see what the situation was? The whole barbershop got shut down. Nobody got paid.
Right.
So what we don't want is for people to hide the information or come, and you know what I mean? So our shops right now, none of them have, you can't come in unless you're vaccinated. They're letting everybody in. You know why? Because it's family. That's the relationship you have with people, which means there are people coming in with different risk profiles. But the event was a 100 Black man event in a completely different location, right?
Right.
And yet they wanted him to shut his business down because of the exposure. That's a big deal.
Yeah.
Yeah, and just interestingly enough, Ann, and I thank you for sharing with us. And I think that we do need to be real with people, because when you're real with people, then they'll listen to you because they say you're not trying to hide something or you're telling me the truth. And we say, where I'm from, they say that's real talk, right? Right. And so I appreciate your honesty and your candor. I had the show yesterday, Doc. I had 7 ministers on the show at one time, talking about the role of the clergy in COVID-19. And one of the ministers said December, he had just buried his mother who died of COVID. Just one minister. The other minister said he was in the hospital, intubated, had to stay away from the church for over 2 months. That was on the same show. And then we had another person said that his son is not vaccinated, and they are having some challenges in terms of their relationship because he wants him to get vaccinated and he not done it yet. And he's frustrated because he knows that he's vulnerable. I mean, this is all on one show. You see? And so what we are doing, people are struggling with family members and friends that will not get vaccinated, and we know what the consequences are. And so we have to figure out how do we talk to people? How do we continue to persist and not give up on people? Just like Aaron said, Aaron didn't give up on his brother because his brother gonna always be his brother, right? And that's how we have to see it. We have to love people through what they're going through, right? That's critically important.
Yeah,
all right, let's see the festival, man. I want to see the festival.
Okay.
And then we'll do the word cloud.
And while I'm setting that up, I want to say this: when Aaron said that he was spinning, what Aaron has done, and with his operation, he's got co-located right. Basically, you got the barbershop right next door is his fitness operation. They do yoga. They got spinning wheels. I mean, it's full service, and on the left side is all the education material. It's like so
I mean,
at some point,
are you his hype man? What are you? I mean, hold on.
Spinning wheels. What are
him
you
on
knitting out
payroll.
there?
I mean, what's up with this?
and he's a former police officer
Yeah.
who got embraced by the brothers and sisters in the hood, and he's saving lives all along the way. Aaron, we'll talk about what happened with nature a little bit later today. But let me take it, Omar, you should see this. I was excuse my desktop, but Omar, I am telling you, when we went into the festival, we had the 25th anniversary of the African American Cultural Festival. We got called. Hey, look at this, Omar. First of all, can you see a full screen?
Full screen.
Okay. Sometimes barbers and stylists out there, listen, you get a call a week in advance to say, oh, can you come XYZ? Obviously, we said yes. It was very intense, and Chris will talk about what it took to make it happen. We made it happen. I'm going to take you inside the festival now. It was on the grounds of the courthouse. Now, here's what's interesting. The founder, Madam Speaker Adrienne Jones, is the most powerful elected official in the state of Maryland. 25 years ago, she started this festival on the grounds of the courthouse so that people didn't simply think of the courthouse as the only place they come to get bad news, parking tickets, and all court cases. So long story short, here we are. It's the first time they actually put a health component in the cultural festival. So here we are. Here's some of the images. We set the barbers and stylists up. Katrina was there. She might be in the Hollywood Squares, but I really wanted you to see this board. I got my COVID vaccine because. Now, here's what I observed. And Dr. Ritter, you correct me if I'm wrong, add your insight. Chris was there. This is what cultural tailoring looks like. And so you see some of the images. We have capes for the barbers and stylists out there. I'm wondering if you have any capes that tell the message. Our Maryland initiative, Omar, is Maryland Barbers and Stylists United for Health. And I asked Meg, Meg's not with us, but the team went back, took all the Post-its, and then categorized them into buckets. Here's the first bucket: family. If you ask people, what was their motivation? Family. Isn't this what you've been talking about, Omar?
Absolutely.
What do you see there? I want to hug my mother. I did it for you see a whole lot of moms out there. You mothers out there have a lot of power. Stepmoms, family. That's the first bucket. Here's the second bucket. I want to stay safe myself. I don't want to die. I don't want to get COVID. I want peace of mind. Okay, I got my vaccine because there are cases in my school. I want to be safe. Spiritual, dream, educational purposes. If we had time, I asked that person to unpack that one, but you kind of get it. Family, then I want to stay safe. But look at this third bucket, Omar. I want to keep my community safe. These folks were not just thinking about themselves. They were thinking about the other people in their community. I want to promote healthy living. I want to teach the children in schools. I want to help my community. I want to protect everyone around me. I came away from this saying, these are the communication messages that are moving the needle for people to roll up their sleeve. And so I will back up just a bit to the big one here and simply say to Dr. Ritter and Chris, add any insight, feedback you want to give to what happened at the event.
Ladies first, Dr. Ritter, get your input.
It was definitely a family event. You could see people, you could see whole families come in to this event, mother, father, and children. You would see them, they were listening to music, they were eating cotton candy, they were getting sodas. It was hot as hell, but they were all there smiling because they all wanted to be together. and they were together. And it was one of the few events in a year and a half where you could have the whole family together having fun. And so that was really an obvious focus and motivation. And I'm using that even as a physician, because patients that I've had for many, many years, I probably see them more than I do my family, and they consider me their, doctor, mother, right? So I'm using that. I want to keep you safe and, do this for me. And sometimes it works, whatever. But that was a huge element of this cultural festival that we learned, and we see it on the board.
And so this sprawling over the entire courthouse, booths everywhere, food everywhere. So we sent our Chris Sherlock out into the wild, and he was driving people to the pavilion. Chris, your observations.
So first, I know we were in the virtual world and we had to see those words on a virtual post-it, but those words were real. They were written in ink from people's hands, coming from their heart. And to see that transition onto the board, for them to share their testimony, for other people to be encouraged, to share their story, it was just surreal. And being involved, all I know is everything happened in the flash. We were there from literally 9 in the morning to 5, 6 maybe. I know I left at 6 o'clock. I'm pretty sure Dr. Thomas left a lot later than that. But to be out there so long, there was still not enough time. It still felt like more work needed to be done. And it was being done effortlessly. So just a quick tidbit, when we first got there, there was just a little, confusion as to who was going to go where. It's a big pavilion, big tents, big everywhere. And so we, drop names, introduce, hey, we're here. Okay, you all can have this table right here. Well, things started happening, the day started going on, and next thing you know, once Dr. Thomas got on the scene, we had 4 tables. We had more than half of the pavilion. And a ton of workers, not even workers, a ton of colleagues who rolled their sleeves up, set their tables up, and were providing knowledge. That entire function was about knowledge, whether it was about health disparities, whether it was about cultural building, whatever stand you went to, there was a stand. It was a stand of knowledge. So to be out there representing the COVID knowledge for where we currently are, we took great pride in that. And when I left the tent, there was no one in there. There was nobody there. By the time I came back, I felt like I was missing the party. I felt like I was missing the party. Like, I wanted to get down in it and see what was going on in the tent, but I had more work to do. The word had to be spread. So I came back in, 20, 30-minute intervals and went back out, pounding the ground, came back again, and the lines continued to grow. And the reason why I would say knowledge is because we had barbers, three barbers on the scene. One little boy decided he wanted to be a little boy as he is and jumped up or moved and slightly messed up his haircut. I mean, you can't move while someone's cutting your hair. The master barber skill trade camaraderie was activated to see other barbers put their capes on and fly in and fix this little boy's haircut. I mean, they were breaking out tools I had never seen before. And they were calling shots. You got to move your hand at this angle. You got to cut here. And next thing you know, little boy's hair was perfect, like straight out of the magazine. Although it was his fault, luckily we had well enough equipped barbers that could fix it. And just to see them sharing their knowledge of their field and their trade out there, and we sharing our knowledge, it was just a tank. I'm still overwhelmed from it. So thank you for the opportunity, to say the least.
And Omar, we had Mr. Wally was there. Go ahead, Jolly, and spotlight Katrina. But Katrina was the key. She was our lead stylist. Come on, give it up. She brought
Katrina queen, man.
She brought one of her crew with her.
Katrina's a queen, man. You need to give her props. She's a queen, man.
Thank you.
Hey,
Go ahead,
Katrina,
Katrina.
how you doing?
How are you?
Wonderful. Tell us about what happened.
Oh, that event was definitely, it was amazing. It was awesome to just be out there being able to, give back to our community, give out those free haircuts and talk to some of the beautiful children and talk to some of the parents and being able to advocate. Some of the parents even got vaccinated while their children were getting haircuts. So that was a great experience to be able to cut and advocate at the same time and give back to the community. It was definitely an awesome event. And Chris definitely did a wonderful job going out there, bringing us the clients and sharing information with them about our hair network. That was awesome.
Now, Katrina, one of the things I observed was when people were in the chair getting their hair cut, they were smiling, they were laughing. It made them more relaxed, Omar,
Yeah.
to walk across and then get vaccinated. I think that there's something about when you sit in that chair and that cape goes on you, you have to let go. You have to let go.
Yes.
Well, you certainly have to trust the person who has those clippers or the whatever it is. Whatever it is, you have to trust them. That's a trust factor there.
And Katrina
Absolutely.
brought one of her apprentices. So now I want you to talk a little bit, Katrina, about how you're mentoring the young lady you brought with you. Give us her name so she's on the record. We're recording here.
Oh,
And
yes, that was.
how you think she did when you put her in that situation.
Oh, she did a wonderful job with those children. Her name is actually Rochelle Newman. She's actually a relative of mine. But yeah, she was excited. She's still talking about it. As a matter of fact, she said she's glad we invited her out to the event. She looked forward to doing another event with us, and she just enjoyed herself being able to give back to the community and talk to the little kids. And she did a little more than we wanted her to do, but she did a great job.
That's wonderful.
Yeah.
I just want to make a point that I just thought of now. There's like events in our life where people say, where were you on 9/11? And, if you were like, if you were born, if you were alive when Kennedy was shot, they're going to say, where did you get vaccinated in COVID-19?
Yeah.
Because I have some guys who come to my office, they're going to say, I got vaccinated in a GYN office. But wouldn't it be cool to say I got vaccinated in the barber chair, right?
Wow.
That's going to be like a key point, and it'll be an honor to have that. So I mean that's just a thought because it's a historic event.
That's a great hook, Dr. Renner.
But Omar, remember, Omar, I have the video of you getting your vaccine. You've seen the video of me getting my vaccine. We put that out there, but something happened at the festival. I want to put on the table here and have some validation efforts happening in other places. We had a senior. She was in her 70s. This is someone who could have been vaccinated months ago. Mm-hmm. She gets her hair cut. And Katrina, I'm convinced that you helped get her relaxed enough to go across and get vaccinated. She got vaccinated. Then we interviewed her, Omar, and it's what she said that I want to share with this group. She said, my family's going to be mad. Wow. I'm not going to tell them. And I'm realizing that depending on the social network you're around, the peers you're around, what did Aaron say? He got his brother vaccinated. Now his kids and wife are vaccinated. Okay, it went that way. But some people are surrounded by the hesitant or anti-vaxxers that she wasn't going to tell her family really stuck with me.
Yeah, I had a 21-year-old who's getting married in 25 days and her husband-to-be does not want her to get vaccinated. So they're going to have their whole wedding unvaccinated. And I was like, oh my, please wear a mask at least. There's going to be a lot of people who are going to want to hug you, right? And I want you to be safe. So I still have a few days to try to get her, but her husband-to-be is the instigator not to get vaccinated.
The other thing, Ann said something, what I do realize is that many people are making technically life and death decisions with very little information or disinformation. And, MSNBC did a thing where they just talked about the number of people who were saying they were not going to get vaccinated. And each one of them made a point that was their reason, and their reason was not even true. And so I think, Dr. T, we got to do a better job at dispelling disinformation, because it is really creating this hesitancy. It's sustaining this hesitancy. We've got to do a better job at giving people the proper information.
Now, Omar, I this is why I give the individual the benefit of the doubt, because there are major reports, front page news of these anti-vax organizations making millions of dollars duping people. They're selling products. It's like an engine that they got going, a machine. And our health departments are not equal to that kind of onslaught. And so I think it's slogging away one by one, if that's what it takes. So let me tell the barbers and stylists out there, I'm glad you had good numbers, but if only 2 people came to get vaccinated, that's a success. That's how you have to look at it, and start gathering the stories. The stories can be just as important or maybe more important than the actual number. And then the visibility for Andre to have Emory come back and do a film. I just showed you a film that was Washington Post did on Luminous. Aaron's got folk. And just describe folk wanting to come out and film. When they come out and do that filming, make sure you're telling your story, not their story. Make sure you get the links afterwards, and then make sure you share that with us so that we can lift you up and promote you like we did today, right, Aaron?
Oh,
with the
yes.
National Association of County and City Health Officials, when we trained those health officials today.
That was pretty nice. I definitely appreciated you, again, including me in that. And, you know, after we got off the call, I started thinking, and I think it was Katrina that just said something that just really dawned on me. And I know Omar will relate to this as a police officer, but, you know, when people call 911, they're not calling 911 because they're happy to see you. They're calling 911 because they need you to help them get out of this maze that they're stuck in. When I thought about just the work that I used to do as a social worker, you know, we encounter people that are really struggling. And I think, you know, that message still has to be consistently put out there, because when we encounter people that have been struggling, you know, it really isn't that easy for them to just, you know, get that vaccination. And that's why we got to keep working with them. We got to keep trying to find that hook. But we also just got to remember that a lot of these folks, I mean, everybody got something, but a lot of these folks have really been struggling. And a vaccine or getting vaccinated is just not registering. And so that's our responsibility, and our challenge is to help move that getting vaccinated to the top of their list, because right now it's way at the bottom.
And making it easy, right, Aaron? Making it convenient.
Yeah.
When your brother wanted to get vaccinated, he didn't go to CVS. He came to the barbershop.
That's right.
I think that what we're doing is obviously making it convenient for people. And I think at this juncture, we have to continue to make it convenient, because people who are hesitant are not going to go through a lot of hoops to get vaccinated. So the more convenient you can make it, I think the more people we can get vaccinated. And so we need to even think about more pop-up barber, you know, in the neighborhood. I mean, let's go and set up and get a generator and start cutting hair right there and get some hot dogs and hamburgers and music going and cutting hair right where they live, right?
Omar, you know, I'm in South Africa many years ago. And what you described is exactly what you would see. They would be on the street corner on a barrel, sitting on a barrel, cutting hair right there on the street. I think that kind of visibility, we need that kind of, while the weather is still halfway decent, to be much more visible on the street corners. I told Chris I'm going to get him a soapbox and a megaphone like the street preacher, and tell the message right there in the corner and get people to come up and give their testimony. That's the kind of stuff we need to do.
Hey man, don't you get Chris put in jail for bootlegging as a preacher.
And, you know, guys, remember when I talked about that? I think 4th of July was a 3-day weekend. And so I took the bus, you know, we put that, you know, logo on the side of the bus, Shots to Shop. And I started driving through the neighborhoods in Madison, and then we went down to Milwaukee. And, you know, we had these, you know, older African-American women coming up saying, oh, y'all got the shot in the van? And I said, no, we're just encouraged. And she said, man, why y'all wasting our time? Get that shot. And it was just really cool because we didn't think, the plan was to just drive through the neighborhoods and just encourage. I wish that we had the insight to know, put some people on the bus with us and have them and that ability to vaccinate folks. That was a missed opportunity.
But that's what they're doing in Alabama. They have these buses that are going through the community, and they're vaccine buses, vaccination buses.
Really?
Vaccine buses, yeah.
That's really creative. And Aaron, you are absolutely right. We called a pharmacy, and they stepped up. All of you, Aaron, Andre, all of you, listen and find out, because some of these organizations are facing expiration dates on their vaccine allotments, and the last thing you want them to do is to toss vaccine. You don't have to. I mean, the pavilion we had a huge clinical staff. You could come down to 1 or 2 people who can give injections, you know, a pharmacist to get on that bus. And those 5 or 3 or 4 or 5 people who are ready, don't waste my time. You could have given them the vaccine. So reaching out to the local pharmacy, the LPNs and nurses, anyone who's qualified to give injection and is certified. These are medical professionals. That's another way. I love that Alabama model. Have it on the bus.
Yeah.
You can walk out to the street corner.
They take it to the streets. That's it.
That's good.
Yeah, absolutely. Hey man, we didn't do the word cloud. Let's tell them how they can do the word cloud.
I said this, that all that we just did might influence what they do next.
But I told you, people gonna feel like they gonna feel.
If there was a word that best characterizes how you are feeling right now, this is going to be in the chat. I'm gonna count you down. Don't hit return. And Ann, if you're still driving, and Andre, you can say your words out loud. But a word, comma, and then I'll count you down before you hit return. So add those words right now. And I'm looking in my Hollywood Squares. I got Cam Thurston out there. Cam's going to build the word cloud. But we also have Jale, one of my young up-and-coming public health students, Omar. And that next generation is important. And Jale was there at the festival. Real quick, Jale, just turn your camera on while they're building the word cloud. Don't hit return yet, people. Just add those words. Jale, give us your thumbnail observation of your experience at the event.
Sure, I'm happy to jump in. And hello, everyone. Happy to be here. And it's great listening to all of you. And I was at the event along with Dr. Thomas, Dr. Ritter, and Chris. And it was just so exciting to see everyone in person, and the way we had the pavilion set up, one side with education materials and one side with clinical people giving vaccines. It was clear how our approach works, and offering the space for information and education while also having clinical people there is an effective way to encourage vaccination. And it was also just such a community-driven event. I live in Baltimore County, and it was the first time I've ever heard about or been to that festival. And I was just so inspired and thrilled to be there. And I was, unfortunately, I wasn't there the whole time, but just the morning and early afternoon period that it was phenomenal. So I appreciate the opportunity to be there and to be on this project with you, Dr. Thomas, as well as everyone else.
Just stay right there. I'm counting you down, folks. 5, 4, 3, 2, hit return. And Cam will build the cloud. So Jolly, think about it. You live in the county, but it was your first time. the African American Cultural Festival. It could be growing up, you didn't think it meant you. When you were there, how did you feel? Did you feel welcome there?
Oh, absolutely. Absolutely. Before I found my way to the pavilion, I was walking around all the tables, and there were so many bakeries that had tents, but also political figures and everyone from the community. And so it was just wonderful to be there. And of course, I felt welcome. It was great.
And she had her T-shirt on, Maryland Barbers and Stylists United for Health. Hey, Omar, with a QR code on the back. That would take you to our landing page. That's how we did that one, Aaron. Thank you very much, Jolly, because you're that next generation. I want you to think about your fellow students and let them know it's very important that we get out of the classroom, off the campus, and into the neighborhoods. Thank you so much.
You know what? That's the spirit of Booker T. Washington. You know, he had the Jesset wagon that took the school into the community. And I think that's what we got to do. We got to get out of these offices, get off of these, in these comfort spaces, and get out there with the people, and really have a relationship and a conversation with people. You know, you make your friends before you need them. And so we need to make a deliberate effort to reach people where they are. I think that's what we got to do now.
Yeah, I don't know if you guys recall early on when we first started, I talked about how up in northern Wisconsin, well, they told us that we could not use haircuts as an incentive for getting people vaccinated. But 2 hours north of Madison, they were allowing 6-piece chicken dinners, fried chicken dinners for people to get vaccinated. And, you know, I remember I was very critical of that. You know, now we're deep into this, and I'm looking back at that and I'm thinking, if that's what it took,
right?
You know, if that's what it took, you know, but it's amazing how just, you know, 10 weeks ago, I was looking at that as nonsense. And now we've just evolved to, hey, if that's what it took, you know?
Right.
Hey, but Aaron, let me say this. When we did our first one, the hospitals told us we can only bring one vaccine, and they were going to bring Johnson & Johnson. And we told them at the time, this is May, that Johnson & Johnson was radioactive because of the baby powder and all the other things. And they insisted that because of their logistics, they could only bring one. Do you know, by the next time, which was just 2 weeks later, they brought a whole collection of them. Okay. So I was glad they were willing to be flexible. And so we're say at the Hell No Wall, in the last mile communities, all stops the barriers have to be removed to get people vaccinated. And that means like we've been doing, meeting them where they are. Hey, Cam, are we ready? Let's take a look at Omar. Let's take a look at the where people are.
Wow. You see the word that stands out again. What do I always say? Hopeful, grateful, appreciative, love, hope, thankful, optimistic, real, positive, rebuilding, determined. Think about that. I mean, so really wonderful words, all of which speak to the fact that we're going to make it through this, and we're going to make it through this together. And that's what hope is. It's the substance of things hoped for and evidence of things unseen. It's being able to see something, although we're not there, we know we're going to get there, right? Jesse Jackson made it famous, and I think it's appropriate to say now, let's keep hope alive.
Absolutely. And this is very, very encouraging. And quite different, Aaron, from what we saw earlier today from the health department officials, right?
That is correct. Yeah, part of it was you had seemed to be a loss of hope it's that the energy was being sucked out of people. So you had some positive, but a lot of it was draining, if I'm not mistaken.
Omar, it's the juxtaposition, it's the comparison. And I think here again is where the barbers and stylists can help the public health professionals. So let me keep this here just for a little bit longer, because one of the things that we do, we ask people to speak to their word. I mean, what makes them grateful? Anyone want to speak to what they see here in the word that they put up?
Yes.
Go ahead, Ms. Lamb.
Hi, how's everyone doing?
Doing wonderful.
Thank you. So am I. My word was grateful and positive, because here in Cincinnati, the Cincinnati Health Department, and also Closing the Health Gap, I've had my second shots at the shop.
Woohoo! Give her some snaps.
And I'm doing a third one on October the 9th, I'm sorry. And so the first initiative that we done, we had a great turnout. We had 17 to get shots, okay? And
wonderful.
That was great. But the second one, we had 27. Some came to get their second shot. We had some to get their third shot, so I mean, it was really, really good. We had a lot of doctors here in Cincinnati, African Americans, to come and just talk to the people. So I'm grateful that the next one will be even more successful.
That is really great news.
Kudos to you and Cincinnati. That's just wonderful.
Yeah.
That was absolutely incredible.
And we also in Cincinnati have a bus too that go around to the neighborhoods.
Yeah.
Also,
you know, that
relief.
That bus is going to be something that we need to encourage every community to have some kind of bus, even if it's a school bus.
Right.
You know, just think about it. What if you went the school bus route, right? And everybody that could stop the bus just like they do the you remember the ice cream truck.
There you go.
And you have the ring in the and you can go and get vaccinated, right?
Got to get creative.
Yeah.
Who else wants to speak to their word?
Yeah, Dr. Thomas, look at with this word cloud. You see this one and think about, this is the barbers, the barbershops, this is the hair salons, this is our word cloud. But think about the word cloud that we saw earlier at the training, where you had a lot of public health folks.
So hold on, Aaron. Cam, go ahead and take that one down. I'll bring the health department up. Yes. This is not a critique. This is an observation. They were honest with us.
Mm-hmm.
I want you to see what they're going through and how what you're doing in the shops can help give them hope. This is the word cloud of our public health professionals, your clinical partner, NACCHO. They brought health departments from around the country. This is what they shared with us today, Omar.
Wow.
Such a difference.
Well, you know, they are where everything is happening. You know, they are seeing people die. We saw the video earlier where the doctor was so frustrated, and you could tell that he was getting weary and well-doing. And it is difficult because, and I think it's even more difficult because we know everybody that dies is a preventable death. It's not like we don't have the vaccine. It's not like the vaccine is not effective and safe. It's all of those things. And so that's what I guess, you know, exacerbate the frustration. Is that we have the solution, and we have people who are resisting the solution that can save not only their lives but others. And you know, and that's frustrating.
Dr. Ritter?
Yeah, I really I'm right in between all this because I went from this screen to the other screen within a week. And I think it was because I experienced our words in action partially at the event. But then I was on that international call today. And I think what our country has suffered is that our health community has not been communicating with the community. And in Paraguay, they call it palados, where they have community-based pooling of resources, and they go to the vulnerable people. They go to the people who are, they call, non-essentials, we call them here. And they go to them for the information of how to help. So our overwhelmed, exhausted, frustrated, stressed healthcare workers are because we're not communicating with the people on the ground and we're being ineffective. So we are the bridge here with the community health workers. And I saw it, just personally experiencing for myself from being frustrated and then being on with the barbers here and learning from you guys. We have to communicate better about health and medicine.
Dr. Ritter, I want you to be honest with us to the extent that this professional rankism and other things that unless they have the experience like you have had with us, that they don't believe that the barbers and stylists have anything to offer. What is it, in your opinion?
We just have barriers in our healthcare system. And that's why my word on our word cloud was rebuilding. We need to totally rebuild our healthcare structure. And the healthcare workers have to figure that out, how to talk to the doctors, and the doctors have to figure out how to talk to the community healthcare workers. It's a lot of work. I mean, it's a lot of work on the ground. It doesn't just happen. I mean, Dr. Thomas, you've been doing this for how many years? I mean, you have to build trust. It doesn't happen overnight.
Correct.
It happens over years. So we can't expect the pandemic for everybody to just like snap their fingers and get it. But, it'll happen. I have hope.
Yeah. I also learned in doing this that the medical community, they deal with data. They like to come from that research standpoint. And so I think that partly a little bit of a disconnect. But I shared this with them when I first opened the doors of our health clinic. We did a survey on how many men were using the ER as their healthcare, and we surveyed 102 guys. 47 was actively using the ER as their healthcare.
Wow.
No matter what, tooth pain, headaches, back pain. So after having offering preventative screenings from the barbershop, we did the survey 2 years later. We surveyed 200 guys and 0 were using the ER as their healthcare. I shared with the medical community that I believe it's a direct correlation between having that health center inside the barbershop. But they heard that. They didn't hear me prior, but when I was able to share that kind of data, that got their attention. And so as best as we can start collecting this data and sharing it with the community, with the White House and these other organizations, I think that's when we'll start seeing them understanding our impact.
This is where we have to share with the IT. We have to get health records, electronic health records in the barbershop. We need to communicate with the IT departments of the health community, and that's how we share our data.
And I don't want you to forget that the numbers all have a heartbeat on them. And so the stories are also important. And that's one of the things that the barbers and stylists literally are swimming in. Authentic stories of people's lives that put this in context, equally important. Aaron, before I take this down, I just want to say and that we now have a pool, Omar, of barbers and stylists who are confident they were already confident in what they did for their profession, but now they're confident about being able to bring medical services, life-saving services into their places of business, and they're able to speak to it on camera. And I think that when we have an opportunity to give them an opportunity to be at the table, like Aaron had today, we would like to do that. I don't want to say we have a speakers bureau, but my point is we're going to be reaching out to you and asking about your willingness to come to different venues, different tables to explain what we're accomplishing. And Dr. Ritter, this is one way of getting more of your peers exposed, who haven't gone through what you have to witness firsthand, but who are trying to figure out how to solve the problem. I just don't want the blame and the shame. We witnessed Omar at the festival. I'll give you just one little example. There was the senior citizen I was talking about. When she got registered, the person on the other side of the desk filled out all the things. They asked her name. They asked her information. They filled it all out for her. But when she moved to the observation space, they handed her an iPad and said, fill this out for your next appointment. And they walked away. And my videographer, Aaron, was watching this 70-plus-year-old African-American woman try to figure it out and had an email address on her. She says she went into her purse and pulled out an envelope with an email. You know how you in church, you pull out a mint in your purse, right. Had an email address on the back of an envelope, trying to look at it and put it in the iPad and put it in wrong. And the reason why I say that is when the health professional picked up the iPad, the woman says to the videographer, "Oh, I gave the wrong email address." Now, my point is this. I wouldn't want her blamed for not showing up for her second shot. She never got the message. But those little glitches, we start blaming people. I think, as Dr. Ritter is pointing out, we got to look at our systems, rebuild our systems. And if I had more staff, we would have held her hand all the way through the process to make sure she could manage that iPad. But we're back in Hollywood Squares. It's 8:16. I can't believe it.
You know how time flies when you're having fun, right? Always. I guess the question has to be, how do we accelerate this? I mean, when you look at the fact that we have winter upon us, flu season is going to be, and Dr. Ritter, I want you to help me out with this. So you compound the flu season with COVID, this can get real bad real quick, huh?
Yeah, I mean, our immune system can only handle so much. You might be able to handle COVID alone or the flu alone, but together that's a double whammy. And then we got the rotavirus for the kids, and it's going to be overwhelming. Last year we got a break on the flu. I think people were masking more often. I think people are unmasking more often. Now we're going to have, it's going to be devastating. So we need to push through this to get more and more vaccinated, both flu, and you can get them both at the same time. Now we have been told they can get the flu vaccine and the COVID vaccine, just have to get them, whoever's giving it, an inch apart. So you got to have a big deltoid. If you have a little deltoid like mine, you probably wouldn't be able to do it.
They're saying, they're saying, we've got people who say, "Oh, I never took the flu shot." Remember our early days, Omar? Saying like early days, the man in the chair interviews.
Right.
Okay. Some of those people have gotten their COVID vaccine. Now we need them to say yes, Dr. Ritter, to the flu shot. Very important.
People are understanding it better now. So if they have never gotten the flu shot before, they're more receptive to it now. And at least that's what I'm recognizing. And I don't know if you guys are going to be giving the flu shots in the barbershop, but I guess you need to talk about that.
The clinical partners, you came for this, come for that. We want them to change their workflow. And Aaron's got it going on. It sounds like Ann's got it going on. And our friend in Atlanta, we don't want them off the hook. If you could do it for this, let's do it for the other things we know these communities are suffering from.
Right, right. And we absolutely need to do that, and we need to be very intentional about it. I think that sometimes when we have these deadlines, like, I was really not happy with saying that we want to get things done by the 4th of July, as if after the 4th of July, COVID just was going to go away, right? I think that what we need to realize is that we need to be laser focused until everybody is vaccinated. We talk about, herd immunity, and we call it community immunity. And they say, now it's going to be 90+%. Let's get 100% of the people vaccinated. That's eligible. Let that be our goal versus, just enough. I don't want to do enough. I want everybody to be safe.
I want to give you an example of a country that was laser focused, and in 2 months, they got vaccinated, and their curve went from up like this down. It plummeted down, and that was Paraguay. And they did it in 2 months. Of course, they're only a country of 7 million, and they vaccinated 100,000 people a day, and everybody wanted it. So, and they're just an incredible example if you go online and watch their curve, because they had
we need to tell that story, Dr. Ritter.
It was just it just went like that, and it was the vaccine that did it.
And if that's animated data, because sometimes you can get swimming now, but if you find that and it's animated over time, I've seen them do that. It helps people understand the dynamics. That would be very helpful, because Dr. Ritter, what you're describing, what we're going through right now in the country, right now, Ann, right now, is as if we're back to before we had vaccines.
Right, absolutely.
We're looking like the situation before we had vaccines.
Over 2,000 people a day contracting COVID or being diagnosed with COVID. 2,000 a day going to the hospitals a day.
Yeah, that doesn't have to happen. I mean,
doesn't have to happen.
No.
So we got work to do, right? And so that's why we do this every week. And we continue to encourage you and to see what we can do to support you and undergird you as you go through this process. But we cannot give up. We cannot give up on our family members. We cannot give up on our friends. We cannot give up on our coworkers. We cannot give up on our neighbors, our community partners. We cannot give up on anybody. We have to stay focused until everyone is vaccinated.
That is definitely a message that we keep pushing. Prior to COVID, our big thing was we wanted to get an AED in every barbershop. We were able to get them in 4 barbershops. And what I encourage the owners to do is to let the clientele know this is an investment in you, should it be necessary. And then obviously COVID came and just really changed things. But anytime we can help the shops understand and help their clientele understand that these efforts are all for them, it really does go a long way.
Hey, Aaron, we too were looking at getting AEDs into the barbershop. And there are challenges with what kind and other but another life-saving device. Let's keep going, because that's a miniaturized tool that can legitimately be put in the barbershop. We've also been approached by the National Institute on Drug Abuse to ask, would our barbers be interested in being training in the use of Narcan if people in the environment are potentially needing a Narcan due to opiate overdoses? All these things we can talk about. Omar, this is the last thing I'll share. We don't always have epi slides, but Dr. Ritter, I think, is showing us this used to be us. This used to be what the United States could do when we come together in crisis. This is what's possible. Dr. Ritter, just quickly, tell us what we're looking at here.
So this is the curve of COVID in Paraguay. In March, they were looked at as being an example of how to suppress COVID because they sheltered in place and they were scared, and it was because of fear. And they didn't have to be told, they just did. They were afraid. So they had very little COVID, and really it turned out to be, you know, the only COVID few cases were of the people who traveled out to China, the rich people who had left the country, because nobody usually leaves the country there. The 70% of the workers are, what do they call them? Common workers. And then,
hold on. So that's period one.
That's period one. Yeah.
Okay.
And then
Hold on. The numbers
Okay,
are all
okay.
the way down to zero. They suppressed the disease. Okay, now period two.
So period two, then they had a P1 variant that came, and they were still sheltering in place, but they had to leave to get food and whatever. So they had this 50% hospital beds were filled. So they don't have a very robust healthcare system there. But 50% of the beds they could handle. And then all of a sudden the Delta came, and that shot up.
Okay, that's period three. Here we go. Period three.
So period three, it was like overwhelming their hospital system at 100%. And this was at the time they got vaccines. And so this was like a 2-month period. July and August, they vaccinated their population.
Amazing. Amazing.
Isn't that a crazy graph? That's crazy, isn't it?
Oh, wow, that's a country. This could be a city. This could be a county. This is how we get out of this, Omar. Vaccination.
That's incredible. That's something we definitely need to highlight. Well, Dr. T, look like the clock on the wall is time for us to giddy up out of here. So we're going to start our countdown. We're going to start with you, Aaron, tonight, and your takeaway for tonight.
Yeah, just again, I'm inspired. I think what you guys, particularly Dr. T, what this is this needs to be taken serious, because this is a movement, and it's working. And I'm hoping that those that are not believers will come around soon. But this is working, that's for certain. And again, I keep going back to my brother. I had an attitude. What I had walked away and say, he's frustrating me. But being on here, you guys just encouraged me. Hearing the different barbers talking, you inspired me to stick with it, and I'm so glad I did.
Thank you, man. We love you, man, and appreciate all you're doing. Wisconsin really is blessed to have you there. I mean, because you are really, you're not just talking the talk, you're walking the walk, man. And we really appreciate you.
Thank you.
All right, Sherlock Holmes.
So it's just a couple of different things with this particular session. I think the word waterfall that really resonated with me this evening, just to see the difference in the words just in our meetings. Some of our meetings typically look like some of what Mr. Perry and Dr. Thomas probably saw earlier today, just in our meetings alone. So to see the small ray of hope that's coming out of our initiatives and our efforts, that is motivation for me, because it's a switch here. And you would think that would be in the medical field where they have the confidence at, but it seems to be somewhat reversed, because they may be too close up on it, and they're seeing things that are relevant to their particular area where they are. So of course it may appear to be glooming, but fear is a figment of everyone's imagination. And I think that's what's really setting in or profound is the fear. So I think we first have to eliminate that fear. You may ask yourself, what fear? The fear that something is going to happen if you don't get the vaccine, because it's the complete opposite. Something will happen if you do not get the vaccine. So you ask yourself, what can we do to strengthen or to expedite this word? That old game, that I think someone made a parallelism on here one time, the telephone game. We had that string in the middle, and you're talking to your partner. We have to tout that string up, because when that string has a droop in it, that message is distorted. And once the message gets distorted, you have people saying things such as, "Have you heard?" That's one of the most disheartening introductions that I can hear when I'm talking to someone, because that means that they're taking it as fact. Have you heard that? No, I'd like to turn those "have you heard" to maybe around to questions. Is it true that? Because once you have them in that, is it true? Then we can start to massage them over. Have you heard? Is they're set, and we're gonna have to do a lot to get them out. So tout that string up, pass the word as accurate as possible, as quick as possible, and one team, one dream. Just get it done, like Nike.
You know, you see how he's getting into these metaphors. I mean, he's like, I'm gonna let you start closing like for me. I love you, man. I love you, fella. That's wonderful. Okay, all right, Dr. Carol Ritter, your takeaway.
Oh, well, caregiver, we're all caregivers, but it's almost like the hourglass is turned upside down and the caregivers need care. And now you guys are the caregivers that really need to give the care. And I really appreciate it, because I'm getting more out of this than you guys are getting out of it. And at this point, that's what we need. So thank you.
Love you so much, and thank you for all you do and hanging out with us. And you're a delight. All right, Dr. T.
Hey, I'm so encouraged. Both Chris laid some knowledge down. Young brother coming up, recognizing what we can do when we work together. Jolly, my young scholar out in the hood, recognizing, hey, I have a role to play here too. I'm embraced, I'm welcome, because we're here saving lives. And then Dr. Ritter, the caregivers need care. Hey, how about deploying the barbershops and giving haircuts to the caregivers? Come on, just like we want to go to the street corner, let's put the cape on them. Let them let go and give them a nice makeover. That would be great. And one of the things that I want to mention to you is that when NACCHO called us, Omar, the National Association of City and County Health Officials, they called us to train them. And Aaron witnessed that it's a beginning, not an end. So whoever said this is a movement, you're absolutely right. And I want everybody out there to be patient. We got one guest. He came on late. I got to introduce him. And that's Joe Wade, our artist. Omar, can we bring him on?
Absolutely.
Joe, turn your camera on. Joe Wade, if you can hear me, turn your camera on. And
you asked him if he was camera ready, man. You get just put people on the spot like that.
I actually
do that all the time. Hey, now we got him. He did comply. Okay, here we go. We elevate him to a panelist. There we go. Go ahead.
Introduce yourself, Joe. Introduce yourself.
Unmute.
Has he unmuted yet?
You see the little microphone on the bottom? There you go.
Okay.
There you go. You're good.
Okay. Associated with Dr. Thomas through the Barbershop Novel Program. And now we're rolling. It seems like the ball is rolling. And look, wow. I don't know. I got a whole bunch of things going on here.
Okay. I want to share my screen so that they can see some of your work on the left here that ran in the Washington Post. Go ahead, Joe.
Okay. Well, anyway, Dr. Thomas and I, we have a little history. We went to high school together. And so we sort of reconnected back down the road a little bit. And he asked me if I wanted to get involved into this barbershop novel project. And quite naturally, I hadn't been doing anything with my art for a while. You know, I had a work career and so on, family, so on. So I had been away from my art for a while. So it was a time for me to really delve in, you know, and really do some meaningful work. So I took the opportunity, and here we are. You know, he asked me to produce some work that would go along with this novel, and I see it is even evolving into, here it is, shots at the shop and all. Hey, you know, hey, it's an encouraging thing to see. You know, the way that I got involved, because I'm gonna be honest with you, I was one of those major skeptics that we're trying to reach. I was like that. Hey, I just had my doubts about it. I had that old fear of medical and science, those inhibitions about those old things lingered for a while. But it comes to a point to where you have to listen. You want to play Russian roulette with your life or what? You know, the numbers were growing so fast that it sort of shocked me into a realization that, wait a minute, hold it. Better safe than sorry. My family, my daughters, they weren't buying it. Pop, you are going, hey, my daughter set my appointment for my shots, both of them, okay? So I just moseyed on down and got the shots, and hey, I'm glad I did. And being involved in this program, hey, I'm very encouraged by it. It gives me an opportunity to do something meaningful with my art, and the fact that it is really reaching out to the communities that need the facts, the figures, and all those trust factors. It need to break down some of those barriers to get to the facts, to understand that, hey, this is not just some passing fancy here. There's a lot of deaths and a lot of numbers and a lot of main people involved with this COVID situation. And the Black and Brown community, we should be lining up at midnight to get a shot someplace. It's devastating our community, and it's devastating a lot of people, but the Black and Brown community are the most directly affected. And the mistrust in our communities, that has to die. And the way that Dr. Thomas and Mike and the guys are working and getting this thing out and bringing people in, and hey, it's fantastic. You know, just to get people to really see it. It's hard to work with us sometimes, but hey, you know, hey, that's the way it is. But I'm glad to be here. But like I said, I'm a little technically challenged with things. I can do some things with my hands, but hey, you know, this thing here, I don't know.
Hey, well, let me just say, Joe, thank you so much for jumping in. And Omar, imagine picking up the phone for talk to somebody you haven't spoke to in 35 plus years.
Right.
And it's like we're walking in the halls in high school again. He always walking around with his sketchbook. That's what I remembered about him. I called him with nothing but an idea, and I sent him the photos from our shops, and you saw one of the drawings that ends up in the Washington Post. Aaron, we're going to turn, and Ann, we're going to turn this into a graphic novel, another way of communicating with our communities. And this is our artist, Joe Wade. Thank you, Joe.
Thanks, Joe, man. Love you, man. And thank you for your wonderful testimony, because that's what it's all about. You know, and in fact, I'm going to let your testimony be my closing. You know, because fear is merely false evidence appearing real. And we have to love someone. If you love someone, you'll get vaccinated. If you love yourself, if you love your family, if you love your community, you'll find a way to get vaccinated. Absolutely. Love someone and get vaccinated today. And as always, I like to leave you with these 2 words. Remember that I love you with the perfect love. But more importantly, remember this. You got the power.
All right. You got the power.
Bye-bye.
Don't play with Delta.
See you all later.
Make sure you have a supply of masks in your shops.
Oh, yeah.
Bye-bye.
Bye-bye.
See ya.